Welcome everyone just coming in. We're just going to wait a few minutes to let people join the call. It's lovely to see you all. If you'd like to, you're very welcome to use the chat to introduce yourself so we know where people are joining from. Let's say welcome just to those just joining the call. We're just giving it a few minutes as people join us. Feel free to say hello in the chat and say where you are from. Oh, we've got some from Austria. That's lovely. Nice to know it's an international landscape. On Canada. I imagine we have lots of different time zones coming together as well then, which is nice. It's really wonderful to be able to share Healing Arts Scotland within a broader international landscape. Oh, in South Africa, fantastic. And the US. Wow, we really are bringing together lots of different people, which is wonderful. Just got a few more people joining. And Lebanon, great. And of course, a few people from Scotland, which is nice to see too. Welcome to those joining. Okay, well, I think we can get started, and anyone who joins in a little later can just check in. So it's just fantastic to see so many of you here with us today and from all over the world. My name is Katie Warren. I'm Vice Chair of Arts, Culture, Health and Wellbeing Scotland, also known as ACHWS, who are hosting this call today. And I'm also a researcher at the University of Edinburgh. I'll be hosting the call for today. So today's event is part of an online programme of conversations for Healing Arts Scotland. We're in association with ACHWS. Now, Healing Arts Scotland's running this week from the 15th to 19th of June. We've got a whole range of free and ticketed events, a national conference, regional days, and workshops. And we'll pop the link in the chat to healingartsscotland.org if you would like more information about that. But we do have this online series of events throughout the week as well if you aren't based in Scotland. ACHWS is a national network dedicated to supporting and advocating for the role of arts and culture in improving health and well-being. So really what we try and do is just link people together working in arts and health in Scotland, but also seek to link that to the global landscape as well. So just before we get started, a little bit of housekeeping, just to let you know, we'll be recording today's session, and this is going to be sent out afterwards to you and others who also registered for today's event. And we're really happy for you to share this with colleagues and other people in your networks. We'll also be monitoring the chat throughout the call, and we'll flag up comments and questions for the panel later in the call. And we also ask you to please mute yourselves throughout the call unless you're going to be asking a question. So the structure for today is that we're going to start with a presentation, and then we'll have a panel discussion where we'll be posing some questions. Then there'll be some time for general Q&A from the audience, and we'll end with a lovely closing creative exercise. So without further ado, I'm absolutely delighted to welcome our first speaker today, Professor Nisha Sajnani, who's co-director of the Jameel Arts Health Lab and also based at New York University. We're really delighted to have Nisha with us to give us a little bit of context for the broader landscape of this work. So over to you, Nisha.
Thank you so much, Katie, and thank you, everybody. It's so wonderful to see you here, as well as those from my two home countries, Canada and the US. Although more and more with the work of the lab, I really am delighted to be able to call a number of places home. So let's see, I'm just going to get this slideshow up. All right, so I'll be sharing with you a few insights from the Jameel Arts and Health Lab in the context of Healing Arts Scotland, and in the context of a wider shift that we're noticing around the world. So Healing Arts Scotland, as Katie's already mentioned, is it's a pivotal moment for arts and health, or creative health, or arts and health. Arts and health, you may refer to it by different terms, and we can get into that in a discussion later. But what I want to signal is that we're living through this broader shift in how health itself is understood. So Scotland's population health framework recognizes that health is shaped not by healthcare alone, but by wider social determinants of health, the environments in which people are born, live, play, work, and age. And that insight is increasingly echoed internationally, that if we want to improve well-being and reduce inequalities and build resilience, that we have to look beyond treatment alone and pay attention to the conditions that help people and communities thrive. And so that's the context in which the Jameel Arts and Health Lab was established. So I'm just going to give you a very brief history of the lab because some of you might be less familiar with that history. So the lab was launched in January 2023 by the World Health Organization Regional Office for Europe, my university, New York University, Steinhardt School for Culture, Education, and Human Development, Culture Runners, and a global philanthropy called Community Jameel. And the lab was created to measurably improve health and well-being through the arts at a global scale. So from the outset, its ambition has been practical as well as intellectual, to leverage scientific evidence, public engagement, and capacity building to drive the integration of the arts into mainstream healthcare and public health policy across 193 UN member states, with a particular focus on overlooked and underserved communities. So research generates evidence, outreach makes that evidence visible and culturally resonant, and capacity building equips practitioners and institutions to act upon that evidence, and policy helps embed it within systems. So since the launch of the lab in 2023, we've built a network of some 24 affiliate researchers and growing from leading labs around the world that privilege different disciplinary perspectives from which they understand the health value of the arts. So some may look at it from a neuroscientific lens or a sociological lens or an epidemiological lens or psychoanalytic lens. And this is important because inter-trans and multidisciplinary thinking, this silo-breaking thinking, is needed to shape the questions and the narratives that arise from the research we pursue, as well as direct and co-produced engagement with the communities that are most implicated. Over the last 3 years, we've engaged 232 researchers and developed 147 community and university research partnerships worldwide in the context of several interdisciplinary and collaborative projects that include experimental, quasi-experimental, mixed methods, research, evidence syntheses, indigenous and arts-based methodologies, as well as implementation research along this continuum of arts and health to better understand the value of participating in the arts in everyday life and in the context of human development and education, to more directed forms of engagement in public health and in clinical care. So this continuum will be published in September in our forthcoming Lancet series, which I'll touch on in a moment. But an earlier version actually appears in a recently published European Commission report on the arts and health, which was published late last year with the title Time to Act. And that's what I'm trying to signal again here, that we're happening upon a cultural moment right now where there's a great deal of momentum. So as I was saying, in the time that I have, I just want to highlight a few collaborative projects that we pursued in the lab that respond to significant global health concerns and that respond to the timing, the time that we're in. So I'm just going to highlight a few. In the area of non-communicable diseases, for example, non-communicable diseases caused at least 43 million deaths in 2021 and growing, and that accounts for some 75% of all non-pandemic related deaths globally. This is an image from Antoine de Gatta. It's actually a heat map of people standing 6 feet apart during the height of COVID in France. However, it also speaks to some of the conditions that lead to NCDs. So of the 18 million premature deaths, 82% occurred in low and middle income countries, which also bear about 73% of the whole NCD burden worldwide, where you've got cardiovascular disease remaining the leading cause, followed by cancers, chronic respiratory disease, diabetes, alongside a growing burden of mental health conditions and neurological disorders. And key risk factors here include tobacco use, physical inactivity, air pollution, rising heat exposure, unhealthy diets. So effective responses must integrate prevention, early detection and screening, treatment, and of course, palliative care. So following a meeting hosted by the NCD Working Group at the WHO Regional Office for Europe on the role of the arts in addressing NCDs, we commissioned and collaborated on two studies, one on the role of the arts in the prevention of NCDs, led by Jill Sonke and published in Nature Medicine, and one that focused on the treatment and prevention, or rather the treatment and management of NCDs through the arts, and that's still under review with Nature Human Behavior, but both present really interesting findings that reinforce the value of the arts in this space. I'd be happy to share links a little bit later in the chat, or if others can find these papers. The second paper is a preprint, but both are online. You're welcome to share those in the chat. The second project that I'll highlight is the Lancet Global Collection on Arts and Health, which, as I mentioned, will be published in September. It'll be launched during Unga Healing Arts Week, which is always held on the sidelines of the UN General Assembly each year. And it'll feature a viewpoint which presents an evidence overview and point to gaps in the research, a narrative review which presents a roadmap indicating 5 priority areas that we need to focus on in the field, and it includes this historic photo essay, which was actually already published and open access online. It was presented during Unga Healing Arts Week last year at the Guggenheim. And the photo essay is historic because it was the first time in the 202-year history of this medical journal that a curated photo essay was published. And here it focused, of course, on the arts and health. It includes 32 images that offer a way to visualize relationships between the arts and health. And I personally like that it was published first because, in addition to being a historic first, it was also a way to lead with the art, to lift up arts-based research and ways of knowing, and to reflect the diversity of the arts and health ecosystem and stimulate imagination about what is possible. The 2 academic papers in the series argue that if health is increasingly understood as relational, environmental, social, and cultural, and not simply biomedical, then the evidence must also be able to be capable of capturing those realities. So we need research that can speak to the outcomes, but also to access, participation, inequity, belonging, meaning-making, prevention, and implementation. We need research that doesn't only ask whether an intervention worked in a small pilot, but also asks what kinds of systems, policies, and partnerships allow creative health to become a part of everyday life. And to that end, you can see on the screen here 4 areas that we've highlighted in one of those papers designed towards strengthening the evidence base. I won't read through all of those, but as I know you'll have a recording of this, you can always revisit it. So in other words, we're interested in building a plural, context-sensitive evidence base for a field that must operate across very different health, cultural, and political environments. And as I mentioned earlier, the lab's research agenda is not just about accumulating proof that the arts are beneficial or where they may fall short or for whom they might not be indicated or in what context, but also explicitly about informing decision-making and catalyzing implementation in public and clinical health systems worldwide. So we've aimed to model this in how we translate science into policy recommendations. For example, in this recently launched policy brief on the role of the arts in addressing the health impacts of climate change. So the brief builds on an integrated research agenda that combined a qualitative survey of 79 practitioners, a rapid review of empirical studies, and analysis of international case studies to examine the role of the arts in localized contexts where communities were organizing to address air pollution, increasing heat, food and water scarcity. And we launched last month with a webinar with ministerial presence in culture and health from Finland and Ireland and our WHO environment colleagues, and collaborated with special guest actor Mark Ruffalo, who co-founded the Solutions Project, and reiterated the role of artists and creative industries in mobilizing us towards being able to imagine living in a low carbon future and reducing emissions within creative industries as well. So since its launch, it's already been downloaded over 3,000 times. I'm really pleased to see that, and we've been able to share it in a few other contexts already. So I see this as an example of translating research in ways that not only expands the field of inquiry, but reframes what a public health response can mean. And so now we're working on policy briefs that relate to youth mental health, museums and health, the role of the arts in hospitals as well, which builds on another international study that we called HOME, or the Hospital Mural Evaluation, which is the largest mixed methods cross-sectional study to date on how hospital murals can shape the experience of patients, staff, and visitors, which we conducted across Nigeria, Slovenia, the United Kingdom, and the US. And the study has already produced a protocol, a scoping review with a forthcoming final study under review. And as I mentioned, it'll inform a new policy brief. brief. All right. So finally, these are actually just a quick snapshot of some of our findings in terms of what the visual arts in hospitals and specifically murals are able to do for patients, staff, and visitors. There's a lot of wonderful insights that I could speak through if we have some time. But finally, I'll just say that the lab's research agenda is closely linked to capacity building, which involves translating what is on the page to practice. So big P policy gets us part of the way there, and then comes the little p, which is about how this work begins to seep into the culture of the way that we do things. And that's involved a global healing arts campaign, a mobilization strategy that we've been doing around the world. We're in Scotland this week. We were in Singapore last year. We were in Barcelona a few months ago. I mentioned we're in New York each year. And Katie Warren and myself and my postdoctoral research associate, Elizabeth Barr, and several others around the world in Singapore and in Spain are working on an analysis of what this social movement is doing. So that's something that we're actively working on right now and hope to be able to share soon. These are just a few posters of different healing arts campaigns that have happened, are coming up, and so on. And we also produce a number of, we also facilitate a number of trainings around the world. So we launched the first arts and health training in Saudi Arabia. With the EU Commission, we've been working on building arts capacity in Ukraine, Moldova, Armenia, Georgia, and Azerbaijan, and have been doing this in other spaces as well, building policy or building training toolkits like this one called Creative Care, which is a resource for artists working in genetic contexts. We've been collaborating with Katie and our colleagues Jill and Daisy at UCL, University of Edinburgh, and University of Florida, and Jenny, who may be on the call as well, on a annual research intensive, and have been supporting global arts and health fellowships in order to really ensure that we have good global majority presence at these trainings to strengthen capacity in the field overall. And we tend to translate each of our resources into films because different media reach different people differently. And so with much of our work, we'll tell the story in 3 to 4 minutes with a short film. And so if you were to go on our website, you'd be able to just go over to films and you would see a number of these. We tend to, of course, mobilize the news as well because we want these stories to get out in the public sphere, right? We want people to be talking about it. We can't take credit for all of these news stories, but many of these news stories feature researchers that we're connected with and that are connected with the lab, which we're delighted about. And I'll just say that, when the original report came out from WHO Europe in 2019 that Daisy and Saoirse led on, and which has since been downloaded countless to hundreds of thousands of times, it's, I think, the 4th most downloaded report in the whole WHO, which is saying something, right? And then you've got this economic report that was launched last year, which also started to lift and elevate the conversation on really what is the economic value of the arts. And if we really want to change policy, there is a kind of holy trifecta, which is, shifting public opinion, demonstrating the cost effectiveness, and weaving in the evidence, right? So I put these here last because what we're working on now is the next big WHO report, where we're going to build on the population health research that has come out of 2 of our affiliate labs, UCL and University of Florida, as well as others. Our global population health fellow, Karen Mack, who's been working on these. This is just a snapshot from one of the studies published by Karen and colleagues in 2023 that speaks to, at a population health level, what does arts engagement do? So the next big WHO report will do this, but for a much larger set of countries, and will weave in an economic analysis as well as look at health equity. And when you bring a health equity lens to this, what do we see? So in closing, the lab's research is designed to travel. I hope that you pick up on that message throughout. It's meant to travel from study to synthesis, from synthesis to brief, from brief to public conversation, from conversation to policy and institutional uptake. It never does so in a clean line. It does so in a zigzag, messy network pattern, very rhizomic. Publication is not the endpoint, but a step towards a wider ecosystem of translation in order to really advance a true holistic vision of health and well-being, where the arts are not an embellishment to healthcare, but part of a complementary preventative approach that diversifies care across cultural, community, and clinical settings and builds resilience by engaging broader determinants of health. So thank you so much again for the invitation to share with you why I think this is precisely the moment to act.
Thank you so much, Nisha, for that incredibly inspiring presentation, giving us a taste of the global landscape of this work. We've had just a question in the chat to ask if you could please share some of the links that you're referring to. I'm happy to put the lab website there, but if there are other links you might be able to share, Nisha, that would be wonderful. We've also got a few minutes now if anyone has any direct questions for Nisha. So feel free to raise your hand or type those in the chat, or you can just unmute yourself. Just give people a minute to have a little think. Rebecca?
Yeah, I was wondering if there are pathways in place for researchers or labs to join in with this advocacy and local expansion, and how do we access them?
Um, in terms of accessing materials, we share everything we produce freely. And in terms of joining, it's always just been a matter of like, what do we want to work on? What would you like to work on? Is there synergy there, like with any collaborative effort? So, Rebecca, I would just say, please reach out if there's something specific that you're interested in. I will tell you that, our lab manager, Yashna, is really great at being able to sort of keep track of some of the interests that people have. And then when we see an opportunity for connection, we'll pursue it, you know, or you might initiate it and invite one of us in. Yeah.
Thanks, Rebecca. Great question. Any other questions from our audience today? Chris, did you have a question?
Well, if it's a bit cheeky since I'm on the panel, but earlier you talked about indigenous knowledge and how and the extent to which indigenous knowledge is or isn't does or doesn't exist in the sort of hierarchy. And I'd just be curious if you would talk a little bit about indigenous knowledge and your overview of that. That would be really kind.
Absolutely. So, I certainly can't speak comprehensively around Indigenous knowledge or research methods, but I've certainly been informed by them. And there's one project in particular that we're working on with the Anishinaabe and Mohawk communities in Turtle Island, or otherwise known as Canada. And we're working specifically on the role of storytelling and theater-based practices, participatory theater in disrupting discrimination in healthcare. This was funded by a Tri-Council grant, a New Frontiers in Research Fund Canada grant, which brings together several funding bodies at the national level to fund high risk, high reward research. And we divided the funds that we received into three working groups: an Indigenous working strand, a St. Catharines or Niagara region strand, which is just around the Toronto area for those who are maybe less familiar with the geography, and then a New York strand. Each of us developed different ways of working, and then over 2 years exchanged on the practices that seemed to have resonance with us. And the Indigenous working group, again, fully self-determining and sovereign in their approach, right? So that's a key piece, is that there was no interference here around the priorities that they wanted to identify and the concerns that they wanted to privilege and the methods by which they wanted to explore what was important to them. We were not imposing any one particular method. That was a key piece of the puzzle. And what they've communicated to us is that one of the values that really guided their work was how to be in good relation with each other and good relation with the generations past and the generations to follow. So in the work that they were doing, they consulted elders in their communities. Elders were present for any of the sharings of the findings. There was a real honoring of the wisdom that is past and present and future, and accountability to the future that I have to say was so impressed upon me and had me rethinking the ways that we were doing things in New York. So just very, very rich. And we will continue in that path to form alliances and opportunities with different Indigenous working groups. Certainly in our work in Southern Australia, there's already a prioritization around that. Every community that we work with, like in Healing Arts Scotland, it's determined by the Scottish Working Group. The coalition of 50 organizations said these are the things we care about. So.
Thank you so much, Chris. We'll just have one more question and then we'll move on and say thank you very much to Nisha. So we've had a question in the chat from Coralie who says, do you have anything to say about the need to integrate arts practices and artists within policy making?
Yes, you need to be at the table. You are at the table. You have to be at the table. Artists think in imaginative, out of the box ways. I don't want to paint artists all with one brush at all, but just to say that artists can facilitate social infrastructure in ways that are sticky, in ways that capture interest and attention, that get people thinking differently, and that's necessary. It's more necessary now than ever.
Thanks, Nisha. We've also had a few other questions for you, which we might make at the end of the call, but otherwise, I'm sure Nisha, you might be happy to respond to a few of those in the chat. But so we might have time to return to those later. But for now, I'm delighted that we're going to be moving on to our panel discussion for the rest of our call. So Lewis Hou was going to be joining us to be facilitating this, but he sent his apologies as he has been delayed due to a flight delay. However, he will hopefully be joining us very soon. So we're going to kick off anyway, and if he joins in, he will take over. So first of all, I just would love to introduce you to our wonderful panel. So we'll go around and just, if you could briefly introduce yourself, who you are, and say why arts and health is important to you. So we'll start with Hannah.
Hello, thank you everybody for attending today. I'm Hannah McIlveen. I'm currently studying at both the Royal Conservatoire Scotland and Glasgow Caledonian University. So I've always had a foot in both camps, one more health and one more dance and creative arts. I started in a care home when I was 16 and it developed a Creative Friday, which met much resistance. People were consumed with a task-orientated approach and were worried that maybe that would fall if we were making time for some more creative approaches, but I really saw the interest and the need for that. So I'm a trained psychiatric nurse and I'm also a dance movement psychotherapist, and for the last few years I've been working for Scottish Ballet in their dance health. So we're talking about a continuum. I work with both actually in the health and looking at treatment, specifically with issues such as eating disorders or personality disorders, and then working through to dance health, where we're doing it for well-being and as part of people's week. So that's me. Thank you.
Thanks so much, Hannah. And Chris, would you like to go next?
Yeah, hi, I'm Chris Fremantle. I'm a part-time lecturer at Grey School of Art in Aberdeen, where we've just validated a master's in art practice in health and arts practice in health and well-being. When I'm not a lecturer in the art school, I work as a producer, mostly on public art projects in healthcare settings. I think I've worked on 7 capital projects as a producer, developing strategies and then overseeing commission and evaluation. Thanks very much.
Thank you, Chris. And Rachel?
Thanks, Katie. Afternoon, everybody, or morning, depending where you're joining us from. My name is Rachel Drury. I am a research lecturer in music psychology at the Royal Conservatoire of Scotland in Glasgow. So I'm interested in how music and more widely the arts influence and shape human behaviour, essentially. When I'm not there, I am the music specialist at Rachel House Children's Hospice, which is in Kinross, which is kind of middle east of Scotland. So I've got a really keen interest in the use of music in paediatric palliative care. And my work involves working with the babies, children, young people who use our service, but also their families. So often working with siblings, parents, grandparents as well. So we take a real kind of holistic approach in relation to the arts and health and well-being. I'm also a freelance artist, and that's taken me into various different contexts, quite a variety of different contexts, but all with a kind of health and well-being angle or lens through which to view things. So that is me.
Thank you so much, Rachel. And then last but not least, Callum.
Thanks very much. Lovely to see so many people here. I am Callum and I'm a researcher with Glasgow Caledonian University. Now, I sit slightly outside of the panel because my interest isn't in health and arts specifically. I am interested in third sector services. How do we take sort of the ideas that are happening in arts and healthcare and how do we implement them and operationalise them and how do we make sure that they're sustainable for the future and that they work for the people who access these services? When I'm not reading and writing about those kind of things, I'm also a punk musician, and that has taken me all over the place, meeting all kinds of people who arts and music in particular have benefited. No, I actually didn't realize that I was doing healing art until I started doing this research and I came into contact with all these different organizations. And then it sort of clicked. I thought, oh gosh, I've been doing this for years. Which makes me think there's actually millions and millions of other people out there who are in the same position as I am who've been doing this and have no idea about it. And I just find that absolutely fascinating. It's been absolutely transformative to my life since I realized this. So, how many other people out there are there that we can reach and just tell them this knowledge and really empower them to go on into the world? Thanks very much.
Thank you, Callum. Yeah, and I think absolutely your experience, while maybe slightly to the left of the others in the group with regards to arts and health, is so relevant because of the conversations concerning social prescribing, asset-based care, community care, and there's so much that we can discuss today that's relevant to the topics and the areas that you're working within. So, our first question is really about the subject of today's call. So, we know that there's a lot of this evidence out there in relation to the impact of the arts. There's a lot of community-based work going on, grassroots level arts. But there's a key question here around what's next? What's for the future? So, we'd really love you to speak a little bit to what do you feel are the priorities in arts and health research, particularly in Scotland? And so, potentially, Rachel, would you be happy to kick us off with that?
Yeah, sure. So I think I'm going to start on a very personal level, in terms of my kind of interest in this and what I think the priorities are. I've done quite a lot of work over the last 4 or 5 years now, looking at essentially children's rights, and their voice in healthcare in particular. And one of my main priorities in the work that I do as an artist, but also the work I do as a researcher, is giving a voice to those who are largely unrepresented and overlooked in the research. So, for example, babies or children or young people or adults who are either non-verbal or non-speaking. And I think that one of the main priorities within Scotland just now, particularly because the United Nations Conventions on the Rights of the Child has just come into domestic law about 2 years ago now. It's a really key moment for us to be able to harness this and look really deeply and specifically about how we're actually doing this in healthcare. How are we listening to the voices of people that younger children who are very often overlooked, and the voices of people who it's actually quite difficult to hear. We have to listen to them in a different way, and it takes longer. And I think that's something that we need to prioritize. I think another thing, and I'll touch on this maybe a bit later on in terms of some of the challenges we have here in Scotland, but I think another thing to think about for me is the equality and the equity of provision across the whole of Scotland. And I know this is something that is a bit more global. That's not necessarily local to just Scotland. It's something that is an issue worldwide, but definitely something worth putting on the radar.
Thanks so much, Rachel. That feels like very important topics to get started, thinking about human rights, equity, and particularly the focus on young people. I'm wondering if, Hannah, you might have a response there, given that you're also working within healthcare contexts, so potentially some of what Rachel's spoken to might also resonate with your work too.
Yes, I really echo what Rachel was saying in terms of the unrepresented voice. I think it's really important. I do work with adults at the moment, so it's different unrepresented voices. But I'm very interested in the people who either haven't had the opportunity to access any of these interventions, or people who have accessed it and perhaps it hasn't worked for them. And these are voices that we don't often hear from, being curious. Why is it not working? What was it about for you? And could we help that in any way? And also thinking about co-production and having other voices, but that has to be meaningful, and it has to be thorough, and it's certainly not tokenistic, because that would just swing it too far the other way. So we really need to think about that when we're designing research and having those voices in. And then obviously I'm interested in the non-verbal side of things, being a dance movement psychotherapist, and really thinking, how do we capture information and having information that's not necessarily verbal information, and having that carry the same weight as something that can be verbalized.
Thanks so much, Hannah. And yeah, Callum, I'm wondering if some of that might speak to you as well, given your broader work in communities. Hannah's talked a bit about co-production. Is that something that maybe you've come across in your work?
Co-production is actually the theme of my PhD. I've come across lots and lots of co-production. But to me, and we touched a bit about this in the introduction as well, for me, the top priority in our area is getting this knowledge we've got. We've got this fantastic knowledge, And we really need to be reaching out there to the people, like Hannah says, we need to be taking it out to the people who can benefit the most from it. And now, one way to do that is to involve them in co-production. So, for example, if you have an artistic pursuit which you know has health benefits, one of the things we can do is we can get people in the door and they can try it and they can enjoy it. But then what we can then do is skill those people to start delivering those services to each other rather than waiting for like an outside organization to come in and do this. And this is the essence of co-production. So for me, how do we co-produce more solutions for more people that's going to deliver more benefits?
Yeah, absolutely. So it's really placing the people and communities at the heart of that decision making and trying to horizontalize those knowledge hierarchies as well. Chris, what about you? What do you see as on the radar for the future and the priorities?
Well, I agree with everything everybody's said so far. I suppose my what I'm particularly interested in is the literacies that are required for arts people to work in health and well-being contexts. What do you need to know? And then I'm really interested in how we understand the sort of knowledge exchange that goes on between across across multiple disciplines. So how do we understand the impacts of artists working in healthcare contexts, and what comes out of those interactions. So that, I mean, that's a more specific sort of set of interests. But yeah, I couldn't agree more. I suppose the other thing just to add is how to do research at different scales. So in a way, we use, certainly in the arts, we use an awful lot of case studies, but then we see the epidemiological work being at a completely different scale. And I'm interested in how we think intentionally about working at with these different scales between the very specific of what a practitioner knows about what they do in the context that they're working with, how that then relates to other practices, and then how that relates to population health.
Yeah, that feels so important and maybe highlights the need for interdisciplinarity and intersectoral work as well. I'm really delighted that Lewis has now joined us. So I'm going to invite him into the conversation. I'm going to step away. So Lewis, we've just done the first question. So over to you to continue the facilitation.
Thanks, Casey, and a very big apologies. Hopefully you can hear me okay. I'm literally just in Edinburgh Airport at the moment on a very 2-hour delayed flight, which was not expected. So, yeah, great to be here, and thanks so much again, and for our speakers. And I was just listening into that, and I guess maybe by way of introduction and setting my scene, and then I'll go into the next questions for the other speakers as well. Why and what do I feel like is a priority for arts and health research in Scotland? I run an organisation called Science Ceilidh, and the work we've been doing, particularly in the last 5 years, has been really coming from a space of cultural democracies. I already heard that from Callum, talking about kind of co-production and really horizontalizing and thinking about how different scales of research, what Chris was saying. I think we've also come from a space where we've been developing different funding models where we can fund communities to lead research. And for us, that's something particularly interesting in the sense of traditionally research, obviously funding goes to the researchers. And so what we've been experimenting with essentially at scale is how can we fund particularly Highlands and Islands communities to lead research themselves. And I think this is something for us is opening up very different conversations about power and co-production and what happens when communities are supported to bring their lived experience into the research questions, into the analysis, into thinking about the dissemination and the impact as well. So yeah, that's maybe just brings a little bit of the lens that we're coming in with, and we support a network called Community Knowledge Matters, which focuses on this key point as well. So I guess with that framing in mind, I'm going to come back to our panel members, and the next question is thinking about, I guess, particularly in Scotland, where do we think there are particular opportunities and challenges in developing arts and health research here at this current time and this moment? I'm going to leave that open. I don't know if anyone wants to particularly jump in at this one point.
I'm happy to
Rachel?
go first if,
Yeah, please. Thank you.
Yeah, so I kind of touched on this slightly, I think, in my last answer. I think actually one thing that presents both an opportunity and a challenge is the geography of Scotland. And I think just for the benefit of people who are joining us from across the globe, just to give you a bit of a snapshot in relation to population and landmass in Scotland in the last census, there was 5.5 million people living across a landmass of 30,000 square miles. In central London, you've got 9.1 million people across a landmass of 607 square miles. So that gives you some kind of point of reference in relation to what we're dealing with here. I think in both of those scenarios, there are both challenges and opportunities as well. But to link that back to my work, you heard me say that I'm a music specialist at a children's hospice. We have families. There are 2 children's hospices in Scotland, and in terms of the number in relation to population in Scotland, that's about right. But if you think about it, if we've only got 2 children's hospices in Scotland and we've got a landmass of 30,000 square miles, there are some families who have got a hell of a long way to travel in order to get to their nearest hospice. Some of them, thinking about those coming from the Shetland Isles, it's an entire day's worth of travel. In fact, over that, in order to get to their nearest hospice. So the geography presents a challenge. It's also about artists being able to get to different places as well, or indeed having artists resident within places, including Highlands and Islands, as you've heard Lewis talk about as well. I think one of the opportunities that our geography brings is the richness of arts tradition across this country, and it is so vast and diverse. If we think about in very broad terms, the notion of Scottish music, that differs from region to region. It's incredibly different within that one kind of umbrella term of Scottish music. And I think one of the opportunities we have as artists in Scotland is to make sure that we're harnessing the local talent, we're harnessing the local artists, we're harnessing the local traditions and the local cultures in relation to health and well-being. And I think if we can do that effectively, we've got something good going on. I wonder if one of another difficulty that arises from that is how we value the arts and how the government values the arts and how the wider UK government potentially values the arts. And I think therein lies a much more holistic problem in and around the fact that the arts are messy, unapologetically so. They're messy. They're often vague. They're often abstract. They don't fit into a nice little neat box. You can't necessarily describe them using really nice, neat numbers and graphs and charts and everything else. So we are in a position of perpetually having to qualify not only the value that arts bring, but also the impact that arts have. And I think that's a hugely important challenge for us to continue to rise to. I was going to say one other thing, but I think I'm going to pass on to, I don't want to hog the chat. So let me pass on to one of my colleagues instead.
Thanks, Rachel. I'm really hear all that, and maybe we'll come back to your other points as well. Callum, I saw you on mute, so do you want to jump in?
I didn't want to jump in front of Chris, but sorry, Chris. So you can owe me one. So yeah, in terms of opportunities, I think the opportunities, like Rachel said, is the people in our communities. There's so many people out there who are just waiting for a chance to do their bit. So I think that part of our job is to really, really sell the value of art and to really take off that sort of intimidating air it has if you're not an artist or like from an artistic community or an artistic family. But I have a particularly salient challenge ahead in the future, and it's particularly for young people, because this morning in the United Kingdom, they announced they were going to introduce a social media ban. So for our young people, and particularly some of the most marginalised young people, we as researchers are going to have to think long and hard, how do we go and reach out to these people? Because it's no longer as simple as putting a message on a social media platform and hoping that our target audience see it. We're now going to have to work through gatekeepers. We're going to have to work through organisations in the third sector, through centralised state organisations, through private businesses, because these people are now essentially the gatekeepers to our younger audiences that we're going to look for. Now, I don't have the answer for that, but I think that's going to become increasingly important over the next couple of years, is we're really going to have to rethink our strategy of how do we engage with these people, particularly the most marginalised, if we can't find them.
Thank you, Callum. And I really appreciate that. And I think that's the timeliness of that and the challenges around that I think one of the spaces that we work and operate in quite closely is in around youth work. And I'm really interested in how, I think in lots of different dynamics, how do we build on that infrastructure? So, young youth work is active, they're already building trusted relationships with communities and young people, and how can we make the argument, how can we build those connections with artists, for example, to kind of scaffold on those relationships? It's something we talk a lot about with researchers as well. Chris, did you want to come in? And then Hannah?
I suppose I think, I mean, the opportunities, I completely agree that the scale of Scotland is a challenge and an opportunity. But it's also an opportunity because it's an opportunity that we can have a conversation amongst ourselves, and actually people have a chance to get involved and to contribute to that conversation. And that's really important. There's something about the scale where you might reasonably be in a room with people who are living and working in the Highlands and Islands, as well as in the middle of Glasgow. That's actually pretty important, because otherwise things end up very geographically siloed. It's interesting that the for me, one of the really interesting opportunities and challenges is the whole idea of evidence, because actually, so there's several things, there's several aspects to this. One of which is actually arts and culture has a very poor evidence base in terms of but actually the arts and health community is way at the forefront. I mean, you look, if you think about the sort of reports that Nisha was showing us, the synthesis report from the World Health Organization, there are no equivalents of that for general cultural and arts. And so actually the arts and health are in a very important position in terms of dealing with and understanding how to deal with evidence. And that includes the resistance to everything being simplified into certain sorts of evidence. And I think that the arts and health community is arts and health practice, people involved in arts and health know that there are times when they have to wave around evidence and go, actually, there's really solid evidence for this thing I'm talking about. But they also know that their practices can't be reduced to simply quantitative outputs. And so there's a really healthy tension in the community, which needs to value the lived experience, needs to value the human dignity part of it, but actually also understands that the epidemiological stuff is really important too. And I think that's a massive strength and something really important and valuable, which can help to change some of the point in effect is to use that grit to get more involved in human health and to actually help it become more human, not just more health. Sorry.
At all. Thanks, Chris. I saw a lot of nodding at that point. So yeah, I hear that. Hannah, how are you?
Yes, I totally resonate with what Chris was saying in terms of the healthy tension. And I think a few years ago, even I was lilting more towards let's create evidence that health professionals understand, coming with my mental health nurse in the NHS hat, and then having my creative side and being frustrated that that's often not understood or respected, and think if we just do it their way, we can speak their language. But what I've evolved to learn is that actually that's not the way either. We need balance. We need something, a give and take and a shared understanding. I think we're still finding our way with that. I definitely agree. My top priority was similar to what Callum was saying in terms of people and communities. I know every country has different characteristics, but I've definitely noticed from working in England and then in Scotland that one of the real opportunities is the connections, and the meaningful connections. So you meet somebody, you build that connection, and actually then you can reach out to them at another point in time and they will happily help you. And that's how we weave throughout all these different communities. I have connections in all throughout Scotland, on the rural places, the non-linked tiles. So off of the islands, there's then non-linked tiles. And they are meaningful, and also people are willing to share those connections. And what that helps with when I've been doing my research is it means that I've been able to share what I'm researching about, but also recruit so much more fluidly and easily, because I can reach out to people and, do you know anybody that? And they have said yes and come back to me with people who I would struggle to reach ordinarily. So I think that's a real strength. And then in terms of challenges, I would say the assumptions. I sit in a lot of groups where people seem very forward-thinking, very open-minded, and yet still they're saying the arts are nice to have. They're not the foundation. They're that if you have time, or we'll pop that on the top. If people are hungry, or if they're worried about debt, or if they're worried about heating, how can they still engage with the arts when actually that needs to flip? We still need to be engaging in the arts at all those levels, even if we have those things, overarching worries and concerns. So that would be my thoughts. Thank you.
Thanks, Hannah. The arts are there to help make the revolution imaginable, right? So it's the changes that we need. And I feel I'm hearing between the different panelists as we come to our next question is, something that really resounds with me. I think there is certainly a thinking about evidence. I won't lie, I'm personally very, thinking about policymaking and thinking about practice change. I'm increasingly I don't know if there was cynical, but I feel like, current practice and policy making isn't necessarily that evidence-based. And I feel like there's always a little bit of I think the current climate would be very different if that was the case. But that said, what I do feel like is leaning into communities, which I think is a very common theme, and the practice and connecting. We've got some really interesting opportunities here in Scotland. We have the Human Rights Bill that's been developed. We have community wealth building. We have years of community empowerment. And so I do feel like we are in a very interesting ecosystem if we can build the connection between these pieces to actually have a coherent kind of strategy around this, and make that case. And I think what's also particularly important is, even though perhaps arguably maybe some people on the policy level are not as evidence-based as we'd like them to be, even if we give them lots of papers and quantitative or whatever it would be, what they do care about is voters. And if we're engaging with communities, what we are doing is we're engaging with voters ultimately, and we're making that case. And so I think there's something very interesting about that, closing that loop, rather than necessarily just resting on the policymaker side as well. So that brings me to my next question before we start opening up to a general Q&A. And I can already see some questions coming into the chat, so we've got a wee bit of time for that as well. But for this question, we're really just thinking about how do we ensure that research connects with that real world practice and policies as well. I kind of maybe preempted that a wee bit, but I would be interested in what people think in terms of that kind of, I suppose, making sure that research feels grounded, it feels relevant, it feels meaningful. I don't know who wants to kick us off.
Yeah, I can start.
Oh, Callum.
As long as I'm not interrupting anybody. For me, again, it goes back to the people in our communities, and I think if we're really trying to engage people with research and really sell the benefits to them, then we really need to be bringing them on as more than just research participants. We really need these people. We need them, first of all, we need them sold on the value of art for health and well-being. And then we need them sold on the value of research. So there's two doors we need to open, which straight away makes things maybe slightly more difficult. But for me, that's where the biggest gains are going to be. That's how we're going to connect people in communities to the work we're doing. And it's beyond the work we're doing. It's we're actually connecting them to like the greater good that we can do through this work. And by making them part of that work, it makes it not our work, it makes it their work. And so I think that's the real that's where our biggest gains can lie. If we can get more people involved, we can get more people involved at all stages of research, including in the analysis and the dissemination, which are the bits that we as researchers sort of try to keep to ourselves usually, because often that's the bits that's getting you paid, But we need to start taking risks. We need to start taking more risks to get more people involved. And we need to accept also that a lot of the time it's just not going to work and there won't be an explanation for that.
Yeah, definitely heard. We got some clapping as well in the panel there. Don't know. Who wants to go next to add to that? Hannah.
There really is something about helping people to understand why it matters, why the research matters. And I think I've even been on a journey like that myself, in that my day job in the NHS, I'm sitting one-to-one with patients, and I can see that value, in it. But it's only so many people, because, I can only see so many each week. However, then when I got my job with Scottish Ballet, and it was more looking at a policy level and looking broader and higher up the chain. Initially, I thought, well, what I'm missing doing this work with the one-to-one. And actually, then I became to understand, actually, I could help more people this way. And that was a journey for me to understand. So it's helping people to understand how their participation, or if you're asking them to complete something, why is that important? What might that lead to? And that comes in with a lot of interaction, maybe more so than perhaps we're used to, making time for that, prioritizing that. And the other thing is curiosity. I think we need to keep being curious about other people's stance, learning from them, hearing from them, whether that be the people with lived experience or whether that be other professionals who are speaking a different language to us, and really trying to learn each other's way, and then we can work greater as a whole.
Thanks, Hannah. Chris, Rachel, I can see some questions coming in now. But Chris?
Yeah, I completely agree with the other panelists. I suppose that there is, Callum, you said it was the analysis and I think the thing that we don't want to let go of most often is that we think we know what the question needs to be. And I think it's very difficult to actually suspend judgment and listen and let the question come out of the context, rather than going, I'm a this, I therefore know that the right and obviously to get research funding, you've got to know how to formulate, you've got to, there are tech, there's skill in getting research funding and knowing how to frame questions, how to identify methodologies. But actually, those things are also all about power. And as soon as you make decisions about those things, you're taking on power, and you need to be prepared to let the power go and hear what actually matters. And I think that then also throws up a bunch of challenges. And so I think going back to the question about opportunities, the other opportunity is things like the One Health agenda, which, where human health and animal health and environmental health are seen as integrated rather than separate items. And I think, the social determinants of health research, where housing is part of, the problem is, real experience is that actually these things are not neat little boxes. So we have to both be prepared to listen, and we have to be prepared to recognize that probably the question won't fit into our neat little disciplinary box, and that therefore, that's my tuppence worth.
Thank you, Chris. And Rachel?
Just to say that I absolutely agree with everything that my fellow panelists have said. Up until this point, I think the notion of the arts as advocacy for society, but also the arts enabling people to advocate for themselves, just going back to Callum's point at the start, so that people have their fingerprints in the research, in the project, in the arts project itself, and in the research. I think there is something very important about that, in terms of ownership, essentially, of that for people, and that understanding of what it does. Just going on Hannah's response as well, I think for me, just because my colleagues have touched on quite a lot of things that I probably would have said, I'm going to throw into the mix the notion of needing to get the funders around the table, both funders for the arts and funders for research, and really kind of having that conversation around what does research look like when it comes to arts and health and well-being. Because again, going back from just to full circle from where we started from in this conversation, we could do a project that covers a hell of a lot of people and does a little bit of good, or we could do a project that covers a very few people and it does a heck of a lot of good. It's this whole thing of, do you want to go a mile wide and an inch deep, or do you want to go an inch wide and a mile deep? And both of those things have a place in relation to arts and research, but we need to be advocating for seriously in-depth, sustained artistic practice and proper funding for that, so that we can look and get the results and get the evidence we need to say, look, this is something that works. And I think that needs a systematic shift in the way that both the arts and research is funded in this country.
A lot of serious nodding there. I know this is of particular interest to organisations like Creative Scotland, for example, who have dedicated funding for this type of work. But even in the grand scale of things, it's still a very small amount of money in terms of, if you think about health directorates, health and social care, which is obviously booming. And so I know that this is a big moment to push that forward for sure. We've got a couple of questions in the chat that are developing. I've also been trying to answer some of the questions as well, maybe some of the suggestions and some of our experience as well. But I'm actually going to hand back to Katie to help us with the Q&A, if that's okay. And we've got loads of questions in there, some from quite early on. But Katie, are you about?
Yeah, perfect. Thank you so much to our wonderful panel. Thank you to Lewis for facilitating, and to Chris, Rachel, Callum, and Hannah for being our wonderful guests. So many interesting themes coming up there. Just a few that I've noted were equity, co-production, working with communities, rethinking power, human rights, connecting with artists, interdisciplinarity, thinking differently about what constitutes evidence, sustainability, and funding. All of these really key areas for us to think about when we're discussing priorities in arts and health research in Scotland and globally. I'm also going to invite Nisha back into the conversation now as well for this open Q&A session. So we've got about 15 minutes for questions for our panel and for Nisha if you would like to raise them. As I said earlier, you're welcome to pop those in the chat or to use the raise hand function. But Lewis did kindly say we have a few already, so we'll kick off with those. So we've got a question from Renee Reed Miller to Hannah and Rachel. As you work with clients who are non-verbal communicators, are you using any tools to track their communication?
Hannah, do you want to go first?
Yes, I sort of replied, but I do find it difficult to type and listen at the same time. So I did actually use an iPad with somebody who was non-verbal, and the iPad had an app on it that she would type and it would speak. However, that's something to really be considered. So we thought about what that was like in terms of writing and then listening to the speaking, and the editing process that happens before I'm aware of it. So it's nothing's ever as simple as just doing it. We really need to think about the context, what that means to someone, what the experience is like. And actually, even at the beginning, she was using her husband's iPad, and it really mattered that by the end of treatment, she had her own iPad, which almost represented her own voice, and this was her way. So that transition really mattered. And it could be anything. It could be art. I've definitely used art before, paper and pencils. But I think what it matters is that way of communicating is a right fit for that person, and we need to be open to what that might look like. And then we also need to be careful that we do truly understand it, or try our best to understand it to our greatest ability.
Yeah, I think again, they're all things that I use in my practice as well. We're quite lucky in, if you've got the technology, there's things like eye gaze, which is a really useful kind of communicative tool. Also Makaton in this country, I don't know if that translates across everybody's country where they're joining us from today, but it's essentially where you would sign the key words in a sentence. It doesn't have all the grammatical yeah, areas that BSL or American Sign Language or whatever would have. I was saying at the very start, I've been working on some research the last 4 or 5 years looking at a reflective guide for the arts in relation to the voice of the baby. So really kind of tuning in to non-verbal cues from the very youngest members of our society. I can certainly put a link in the chat if that would be helpful to have a look at that resource. We're about to start looking for funding to develop a similar resource working with older children who are maybe non-speaking or non-verbal as well. So I can share that research with you as well if that's useful.
Thank you so much, Rachel and Hannah. And yeah, I think that sounds wonderful to share that link if you have it, Rachel, in the chat. We've had another question from Caro who would like to know, do you have any thoughts about how we reach clinical communities? Would anyone like to offer to take that question? Hannah?
I just think that's really important regarding my most recent role at Scottish Ballet. So I've been in a couple of roles there, but the most recent one was Health Partnership Manager. And what my role involved was taking the way that the ballet work and what their aims were, and then going and speaking to health professionals because I understood the health professionals' language and the way it went. And I won't be the only one with an understanding of both fields. What that did was, Hannah the nurse, it does not have doors open to people like chief execs of different NHS boards. But within that role, I had those meetings. I had an audience with people at that level and all the way throughout because it matters for lots of different roles. But it meant that I had a seat at the table and then I could speak in a language almost like a translator between both. And I think we need more of those roles.
Thanks so much, Hannah. Any other reflections on that question before we move on? I thought it was a really great answer. If not, we'll move on to our next question. Nisha, I thought you might want to speak to this one. So we've had a question about involving different stakeholders in dissemination, and I know the lab have done that in lots of different creative ways. So the question specifically is, do you have any thoughts on how to involve applied research stakeholders? So these are things like extension workers, field specialists, community development practitioners involved in dissemination work in arts and health.
How to involve these practitioners in the dissemination effort?
Yes. So I was thinking about creative knowledge exchange. I know the lab have done lots of that kind of thing involving photography, video.
Exactly. I mean, you've said it. We translate things into photo essays and into video to try to speak to different audiences and different preferred ways of picking up information, and ideally to inspire and to motivate. And I think when it comes to reaching any of our audiences, like any of you, we'd be thinking about, well, who is that audience? What matters to them? What in what form might this knowledge be best shared? And in what language? When we were working on the climate policy brief, we went through so many different versions of it, and I don't know that we got there. You would probably be the best judge of that. But when we shared maybe draft 3 with the WHO environment folks to review once more, because it was a team effort, but they had a couple folks on their team that would sort of come in for higher level reviews. Some of their feedback to us was like, listen, some of this just sounds like policy speak. And I know we're policymakers and that this is something that's coming from a global health policy body, but we actually want it to be as accessible as possible, even to us. Like, we want to be able to understand what we're saying to each other, and that we don't want to shroud it in things that make it sound too complicated. And that was an interesting moment of learning, just like the work I was sharing earlier around Indigenous and other creative practices to be able to communicate the findings of research in Canada around healthcare discrimination, that our different strands wanted to represent findings through poetry and through song and through movement, and sometimes through painting, through just direct address, and it really varied, but it made sense why people were making those choices. So
thanks so much, Nisha. Yeah, that accessibility part feels just so essential. And it feels like the lab have done so much to ensure that the way that you share your work is engaging. So hopefully that's helpful. We've also had a question about disciplinary differences. And Chris, I wonder if maybe you might want to speak to this because you talked a bit about this in your response earlier. So the question is, do you have any recommendations for navigating disciplinary differences between the sciences and the arts when applying for funding?
Wow. Um, um, so I, yeah. Yeah, I mean, if effectively you've got to develop your literacy. But actually you also, I mean, so I have now been involved in 4 UKRI funded multidisciplinary projects. I mean, they're all environment projects rather than health projects. Um, so it, on one level, there's one way to look at it, which is actually certainly in environment research, they want art, they're being called on to be interdisciplinary. And so you get a call going, you want to come and be an arts person on a tree health project. And so you have to one, be prepared to learn about tree health and tree adaptation, fungal infections in trees, and so on. But you also have to be prepared to be a very effective advocate for what it is that the arts bring to the table, because the assumption is it's all about communication and engagement and not about primary knowledge production. So you need to become literate in the territory that you're involved in, but you also need to become a very effective advocate for what constitutes rigor and knowledge from the perspective of arts and design. Um, and then you've got another problem, which is that actually there's a real likelihood that once you get the funding, people will go and get on with their bit of work. They'll go and do their sampling and run their tests. And actually to really build an actual interdisciplinary process, that isn't a given. And actually the arts are very good, mostly because we don't understand anything, so we have to ask a lot of questions. So, but actually don't take it for granted that just because a project has a bunch of disciplines in it, that any sort of actual collaborative work will really go on, unless you build it in from the beginning and you use the things that the arts are good at, which we've talked about actually already. So sorry, long answer.
No, that was
Apologies.
great. I think that need to speak different disciplinary languages, engage in knowledge exchange, placing the art as central within that process all feel like really important insights and tips. Callum, I want to bring you into the discussion because we've had a question about working with those who are low income or digitally excluded. And I know you sort of alluded to that a little bit in your discussion earlier. So this person's interested to know, like, how do we bring in those groups? How do we make this kind of work more affordable and more sustainable? So from your work, I know you've done a lot of co-production, working in communities. Did you have any thoughts on how to do that?
Yeah, one of the biggest things that we encountered, so I'll just sort of switch hats now. So I'm a researcher and my area is co-production at third sector services, but specifically young people. But I'm also the trustee of Outpost Arts, which is a creative wellbeing organisation down here in southwest Scotland. And one of the things that we encountered was that people, so we've talked about already, there's the rural geography, which has been really difficult, but that also adds into a sort of financial disadvantage for these people because it's not just the distance from the service they're using, there's also the cost of getting there and stuff. So one of the things that Outpost Arts have started doing as an organisation is they're building into their budgets and their funding some money set aside to help people overcome these financial barriers. I think once they've sort of cracked the financial barriers, it then means we can say, but you can afford it. So then we can start tackling all the other barriers. But that is one of the ones that we found the most, was that people were the distance then meant people were financially excluded. So to get people involved and progress our mission, it's really a case of getting people over these first hurdles. Once you get over these sort of first hurdles, another one is that people are anxious. They're not sure about what's going to happen when they go to this service. They're not going to sure what can I bring to the table. I've never done anything like this before. So really, our job is sort of we're trying to help people overcome these first initial barriers. But to me, not speaking as a researcher, you're speaking as a sort of practitioner. To me, once we get past these first initial barriers, people then open up and they're so much more willing to buy into what we're selling.
Thanks so much, Callan. I think it's so important what you said about financial support as well, because whilst it is important to provide other kinds of support and to provide people with social capital, connections, community, symbolic capital, like ensuring that people really do have the income and the support to be able to engage in this work is really essential. We're just going to take one more question and then we're going to hand over to our wonderful colleague Jenny Lee to facilitate a creative exercise for us to end. So we've had a question from Minette who would like to know some reflections on research directions or trends that we might be seeing within the kind of arts and health space. So what are the key kind of trends that we're seeing in this space? Would anyone like to speak to that question?
Sure, I'm happy to come in a little bit. I mean, I see some trends with regards to what keeps showing up in the limitation sections of people's writing. Like when we publish research, we will often talk about, this was just a pilot and the sample was really small and we need to increase the numbers, and we don't have longitudinal research. We don't know if these effects remain over time, and we don't know the dosage. There's a lot of things to work out, both in terms of what we report in research consistently, like who did we work with, for how long, what frequency, what was the protocol, what did people actually do, so that when it comes to aggregating findings, it becomes a little easier, and then being able to get a little clearer around who we're working with, and for do the effects that we see remain over time. Are we able to compare what we're doing with a control group? And that's not possible, and nor is it advisable in every single situation. But those are some of the questions that I see come up again and again. And in terms of like where we can go, gosh, that's really big. I will say there's a lot of enthusiasm and interest around how do we move this, how do we integrate this with AI, and what are the technological solutions around this, which I feel a real tension around, because so much of this is about actually sort of valuing the in real life benefits of aesthetic engagement with people and about restoring social connection through the arts. But it's not to say that there isn't integration to be had there. I've seen some really brilliant arts and health sensory experiences, as well as digital art therapy experiences that have been really useful. So anyway, but those are some of the things I'm seeing.
Yeah, thank you so much, Nisha. And I think part of what you've just said there, Nisha, also reflects some of our conversation today. Some of these trends have been, interwoven within our discussion when we were talking about what counts as evidence, like who should we be working with, what is the future, what is interdisciplinarity. So I think so many of those trends really have been embedded in today's discussion. But thank you so much to all of our panelists and Nisha. I'm now going to hand it over to Jenny Baxley Lee, who's going to lead us in a lovely closing creative exercise.
Thanks, Katie. It's such a delight to be with you. I would love to invite us to close our session with some haiku writing. I hope that you're familiar with this form, but if you aren't, I'm just going to drop a little note here in the chat. Haiku is a 17-syllable poetic practice. It's usually written 5 syllables, then 7, then 5, and 3 lines. So I thought we would use haiku because it's a really beautiful way to connect research to the real world, which I think was part of the aim for this session. Haiku is really the poetry of the real. It often is an insightful form, one that allows a revelation to happen, but it always happens in the context of the familiar. So I'm going to read a couple examples for us, and I'll also drop them in the chat. And in the meanwhile, if you'd like to grab pen and paper, if you like to work analog, or open a note or a doc on your computer, I'm going to invite you to do a little writing as well. So my hope here is that we'll engage haiku around what we encountered during this research session, what it has told us about the world, about ourselves as human beings, artists, and researchers. Basho, the 17th century Japanese poet, said, if you wish to write about the pine, go to the pine. Yeah. So that's the spirit within which I invite you to practicing haiku today. Here are a couple of examples. Again, I'll draw from Basho. A bee staggers out of the peony. Enough. Here's a second example. From time to time, the clouds give rest to the moon beholders. And just one more here. This is Virgil Hutton. Dusk over the lake, a turtle's head emerges, then silently sinks. So with these examples, I invite you to engage haiku as well. What have you encountered during this session? What has it taught you about research, maybe research in the landscape in Scotland, about being a human being, an artist, and a researcher in the field of arts and health? Off you go. So I've dropped the prompt there and a couple of examples. As you begin writing, if you have an example you'd be willing to share with the group, please drop it in the chat and we'll read a few aloud. Oh, this is exciting. I see them rolling in. Keep them coming. And don't be too bound by the syllables. It's perfectly fine to interpret them, have a few syllables less or more in any given line, or even to give up the three-line structure altogether and just write succinctly. So I'll just read a few. Art calms the tempest. We are a community. We can make our mark. Beautiful. Thank you, Rachel. Bubbling streams, floating thought, dancing between ideas, listening, listening. Thank you, Lisa. And Lewis, I see yours. Rushing in, delayed. Shared experiences in a short period of time, taking away hope. Gorgeous. Screens light up the room. Voices join from miles away, mapping paths to heal. I see coming in a few more, and please keep sharing. Scrolling back here, we have Nisha's across shared stories. We map wounds, wonder, and care. Research learns to feel. Beautiful. I see heart beats by hearing, looks for more, and smiles, connecting. Equity, connect thoughts, feelings, and time. What is the future? Creativity. The arts are healing our community. Beautiful. Time for just a couple more. Complex geography. So much opportunity. Together we can. Beautiful. Seeds are planted. Wonders are nurtured. Let's rejoice together in this infinite possibility. Thank you. Many voices meet. Research listens. Art responds. We learn how to care. Oh, these are so gorgeous. Cables and screens now give way to paper and crayon when we meet. What joy. Lovely. All right, I'm going to turn it back to Katie. Thank you for the beautiful creative writing practice. This has been a pleasure to read. Gorgeously done.
Thank you so much, Jenny. I hope you all agree that that was such a wonderful way to ground us in all of that we've experienced in this session and to distill what we're taking away today. It was such a lovely way to finish. So I hope you just join me by thanking all of our speakers, Nisha, Lewis, Chris, Rachel, Callum, Hannah, and Jenny at the end there. And also thank you to Sarah, who's actually been in the background supporting with some of the technical side of things and supporting the hosting of these events. If you have any other questions or comments, please send them to info@achws.org. I'm going to pop this in the chat now. We'd also love to hear what you'd like to discuss at future creative health conversations just like this one. So please get in touch if you have topics or ideas. And if you're not part of the ACHWS network, please visit our website, achws.org, to find out more and sign up to the newsletter. And we, of course, very much hope that we will see you at more of our Healing Arts Scotland events this week. But for now, thank you so much for joining, and we wish you all a very pleasant evening in the UK or a morning or wherever else you are in the world. Thank you so much to you all. Take care.